Good morning. I'd like to welcome all of you to Methodist. Thank you for taking the time to join us today. My name is Karen Stump. I'm the chair of the board of Methodist Health Services Corporation, which is the parent corporation for Methodist Hospital, the Physicians Group, and our joint ventures. And today we are here to celebrate a new parent coming along, a parent to the parent, I suppose. So it is my pleasure to introduce Bill Lever, who's the CEO of Iowa Health System, our new parent. Bill?
Great, thank you. Thank you, Karen. I appreciate that. And in addition, you'll hear some more from Karen in a moment. You'll also hear from Jean Blanc, who is our chair of our Iowa Health System Board, a citizen of the Quad Cities, very involved with our senior affiliate Trinity in the Quad Cities. Then you'll also hear from Debbie Simon, President and CEO here of Methodist Health Services Corporation. We are pleased to announce the new affiliation between the Iowa Health System and Methodist Health Services Corporation. Iowa Health System welcomes today its As usual, Jean didn't follow exactly the script, but well, Methodist will be our 8th senior affiliate. It is our first senior affiliate that we've added to the Iowa Health System in 10 years. So this is really a great day for the Iowa Health System. It will be a great day, we believe, in the future for Methodist Health Services and all that they do in the Peoria community. This affiliation means a lot of different things, but it really means the coming together of two organizations that have shared values, have a shared mission, in many, many ways, the same type of culture that is focused on the patient, focused on how do we do the best for our patients and the communities that we are serving. The Iowa Health System, with 7 other senior affiliates, and you see them here. I should also point out our physicians and clinics will be our 9th senior affiliate. That will happen this coming January. With our senior affiliates, we work together to focus on creating the best outcome for every patient, every time. The Iowa Health System operates under a form of governance and operating model that allows Methodist, as well as all of our other senior affiliates, to do what they believe is the best thing for their community. Our fundamental philosophy is that healthcare is local. That healthcare in Peoria, the citizens of Peoria, focus on Methodist and their physicians. The relationship to healthcare in Peoria is primarily between the patient and their physician. And generally, most people don't think about the parent. They don't think about the Iowa Health System. So we allow Methodist, and will allow Methodist, to take responsibility for the care that they deliver in Peoria, to look at the services that make sense for Peoria, to look at the relationship with their physicians and their home care and other agencies that help them in the care of the patients here in Peoria, figure out how to organize that, figure out how to operate that, figure out what is the best way for that to happen here in Peoria. Now, our system also encourages Methodist and all of our affiliates to learn from each other, to understand what works best in a certain circumstance or a certain situation. And I think one of the things that Methodist is very interested in is getting exposure to our other affiliates, to learning best practice. And I'll tell you that our other 7 affiliates are anxious to learn from Methodist, because Methodist has great outcomes, great patient satisfaction, great patient experience, and we know that we're going to learn a lot from Methodist. So this aspect in this concept of local control is very important to our affiliation principles, and I can tell you, and Karen will talk about this in a minute, was very important to Methodist. What Methodist wanted in this affiliation was to keep the resources local, to keep the control local, and our model offers that opportunity. Now, the other thing is we look to the future. Iowa Health System, and as Methodist, looks to the future. The world is changing. The environment that we operate in is changing, will change. And we believe it will change for the better. That the focus on today, right now, is on fee-for-service medicine. The focus today is on quantity. How much quantity of service can we deliver and bill for? Our future is going to be about how do we take care of our patients, particularly those who suffer from chronic disease. How do we keep them at home? How do we keep them out of the hospital? How do we keep them from keeping or making frequent visits back to the emergency department because their chronic disease is out of control? We have been an advocate at Iowa Health System for that kind of a system, to take accountability for the health of the population that we serve. Methodist shares that same vision. They have been talking about the same thing for a long time as well. And as we talked about this affiliation, it became clear that we have the same view of the future. Now, to manage population health is expensive in the sense that we need to be able to coordinate care. We have an infrastructure that's required, that's expensive to coordinate care. One of the things that benefits the Iowa Health System is moving and expanding into Peoria allows us to manage more population, but also to take the infrastructure that we will share across all of our affiliates, to share that with Peoria, Methodist in Peoria, and lower their cost of managing coordinating care, as well as lowering the cost for all of our affiliates. We are excited about the future. We are excited about this partnership with Methodist. They will be a great affiliate. All of our other affiliates look forward to meeting with them, to greeting them, to welcoming them as part of the family. We believe that we will add value in Peoria. We believe that what happens today at Methodist, probably for most staff, will not change. They will see their organization very similar to what it has been in the past. What we hope that they will see, though, is that with the Iowa Health System, Methodist is leading Methodist and the care of patients in Peoria into the future, into a different way of treating, caring for patients. Ultimately, we share the same vision. Best outcome, every patient, every time. So with that, I'm going to ask Karen Stump to come back up and talk a little bit about why Methodist chose the Iowa Health System, and we'll have a couple other speakers. But let me just conclude by saying we're excited. This is a great day, and we believe that Methodist adds tremendous value to the Iowa Health System. We are very confident the Iowa Health System will be of tremendous value to the Methodist organization, but more importantly to the Peoria community. Thank you very much.
Thank you, Bill. I don't want to repeat everything that Bill just said. I will just tell you, though, that the board is on the very same page as Bill. Everything that Methodist board and leadership team was looking for in a partner, I think we found in the Iowa Health System. We were looking for a strong organization that had the same culture as Methodist, mission and values. They had to be strong financially, Geographically, they had to be accessible, and it was very important that we remained a not-for-profit organization. The Board of Directors felt that that was the best way to continue the standard of care that Methodist has enjoyed these past many years. We are keeping the board in place as it is. We will get assistance from the Iowa Health System Board, and just as the people in the hospital and the medical ranks are going to learn from their counterparts at the other hospitals, I think the board members are going to learn from the other hospitals at our senior affiliates. This process has taken at least 2 years, and many in this room were very directly involved in the process, but all of you were indirectly involved in the process, because while the board and some of us were a bit distracted by this affiliation process, the people here and the people that are still at the hospital and the offices right now, they are not taking time out from their busy day. You kept up the standards that we expected at Methodist. In fact, you continued to improve them. We continued to win awards while we were looking for this affiliation, and that made it much, much easier for us to feel that we were strong going into the affiliation and it could only improve our status. So I thank all of you and give you a round of applause for everybody in this room that helped. I've had the pleasure of meeting several of the board members from the Iowa Health System, one of whom is here, Gene Blanc, and he's going to say a few words. Gene and his wife, Lynn, live in Moline, Illinois, so he's an Illinois resident, and I understand that he's pretty familiar with Peoria from his business dealings down here, so I hope we see a lot of him. Gene?
Thank you, Karen. As Karen said, I am from the Illinois Quad Cities, Moline, family that lives down in the Galesburg, Peoria area, and we do a lot of business here with one of your major corporations here in town. I think it begins with a C, Caterpillar, and yes, it colors yellow, and it's got to be the right yellow color. But I have to tell you, this is truly, truly an exciting day, not only I think for all of you, but especially for me. When I came down here, as Karen said, almost 2 years ago, sometimes you know how when you put on that glove, you just know it's the right glove, or the pair of shoes, you just know it's the right shoes. And it was the people. It was the board, it was the physicians, it was the nurses, it was the staff, it was the clinicians that I got to meet and got to talk to. And realizing, having been in the Quad Cities, living in the Quad Cities, knowing that the quality health care that you all provide down here, I was extremely excited that day knowing there was an opportunity for us to bring this together. As healthcare reform is driving a lot of changes and challenges, we all have to take a look and a view of how are we going to do it today and tomorrow versus the way we did it yesterday. And Bill mentioned a few of those things that we'll be looking at. But this relationship exemplifies the overall responses to those challenges, our responses as a system, and Methodist's response to those challenges. It will be mutually beneficial. It will definitely be mutually beneficial. There are things that our affiliates can do, and they'll do them much, much better than any system sitting anywhere. You know your people, you know your physicians, you know your nurses, you know the needs of the community. That's the important thing. That's the thing we learned in the Quad Cities some 12 years ago when we decided to join the system. We have the same questions, the same concerns. Our staff had some of the same questions and concerns that you may have today. But I got to tell you, we sit there today and know it's the best thing we ever have done. When you look at the changes we've made, the changes to healthcare in the Quad Cities, the position that we have, just a tremendous, tremendous effort of our local group, but also supported by Iowa Health Systems. As I said, this arrangement is best for both of us. Methodist brings a very strong organization and a healthy community to this system, a system that will help provide that health and that quality health care way into the future. Peoria is also very critical to us as a system. It's a community in the center part of the state. It gives us the ability to enhance our growth and expand into Illinois as we go forward, meeting those challenges, the changes of healthcare reform. This moment, I'd like to introduce to you the interim president and CEO of Methodist, Debbie Simon. Thank you.
Thank you, Jean. Wow, it's great to see all of you here. The home team, as one might say. Well, that felt pretty good. Well, I am very proud of the Board of Directors' decision to join the Iowa Health System and for Methodist to become the 8th senior affiliate. This affiliation will benefit our patients, our physicians, our employees, and the community. As Bill has said, the business model of Iowa Health System is to retain local control. For an example, all of our employees will retain their positions, hiring will be done locally, you'll still be seeing the same management team, the same faces, and the resources will stay here in Peoria. As Karen mentioned, that was a very important principle that the Board of Directors investigated as we went down this journey. And yet, Methodist will be able to take advantage of the many strengths that Iowa Health System has to help us to continue to advance our mission to deliver outstanding health care, period. I'm excited about this opportunity. I'm excited to be part of the expansion into Illinois. And I look forward to a new era in Methodist history. I've been here a very long time. We've seen a few major changes, but not a new era. And this is a new era. I'm looking forward and asking for the support of all of you as we journey forward with Iowa Health and bring our community into this Iowa Health partnership. And someday we will look back, just as Jean mentioned, and brag about all the things that have happened along this way. Thank you for being here today. We would be glad to entertain any questions to add perspective to what we've already communicated, and I'll let it go at that. Thank you for being here. Let's just see if there's any questions. So if there are any questions, we'll just let you shout them out, and one of us will respond if there are any questions. Laura, Rose, anything else we should do? Anything else?
Also, if anybody wants an individual interview, any of us would be happy to do that as well.
Well, thank you again, and thank you, the media, for being here today. I appreciate it very much.